You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the latest advances in facial plastic surgery. If you are unhappy with the way your face is aging, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Jeff Rawnsley. Dr. Rawnsley has a private practice at UCLA, where he is clinical director of facial plastic surgery and clinical associate professor. He established the Facial Aesthetic Center and continues to train residents and fellows in facial plastic and reconstructive surgery. He has published numerous articles and regularly appears in the media as an expert in the field in such outlets as the New York Times, Reuters, Dateline NBC, CBS, and many others. He also lectures to the public on advances in facial plastic surgery. We've invited Dr. Rawnsley on the program today to discuss the keys to creating a natural-looking facelift. Dr. Rawnsley, welcome to the program.
Thanks so much for having me, Randy.
Before we get into today's topic, tell me about your role at UCLA.
Well, when I finished my training in facial plastic surgery, I stayed on as full-time faculty there, and I trained for years.
So you teach other doctors?
I teach other doctors everything I know about facial plastic and reconstructive surgery.
How much is art and how much is science?
You know,
I guess you can't teach art.
You can't. I mean, there are art classes, but you can't really train somebody's innate ability.
So some guys have an eye for it?
And they know it, and most of the time, and they certainly can be cultivated. But there are, definitely people that are just better and have the eye and can put all the pieces together. And that's why I think it's very important in facial plastic surgery to get somebody that has that ability of the artistic background to be able to see the big picture and to put things together in a way that's beautiful.
So your background, head and neck surgery.
Right.
And then you move into facial plastic.
Right. I spent 6 years studying head and neck surgery, intimately knowledgeable about the anatomy, which is really fascinating. But it's given me a huge respect for that anatomy. And I then did extra training in facial plastic surgery, combining everything I knew into usable techniques that could provide a beautiful result.
Now your practice is right there at UCLA.
Yes.
Is that right?
Right.
So it's on the grounds?
I operate at UCLA, at the surgery center there. All my surgeries are outpatient surgeries, and my clinic is both there, and we have a private clinic across the street.
Do people think sometimes just because you're at UCLA that maybe you're just experimenting on them, or you're like, does that ever come up?
No, it's true. I've had people say, well, residents, I don't want Dr. Rawnsley, I don't want anybody to operate on me except for you. I reassure them nobody does.
Okay, so that's not the case.
No, not at all.
Okay, what kind of patients do you have? I guess you don't do liposuction or breast work or anything
like that? Yeah, I don't do any body. I just do facial plastic surgery. It's what I'm interested in. And I think, like anything, if you specialize in it, you'll get better at it.
When did you know, I want to be a plastic surgeon, facial plastic?
I think when we first started to do rhinoplasty, I think it's probably the most transforming surgery for patients, the nose, because it's right in the middle of the face, and all of a sudden, you take the bandage off, and it's very dramatic, and all of a sudden they have this, a beautiful nose. And what I noticed, Randy, is really that their eyes suddenly pop out. You're no longer looking at the big nose because it's blended in with the natural aesthetic lines of the face, and their other features come to the forefront.
Now, our show airs nationwide. I've interviewed a lot of plastic surgeons. Most of them, I don't think people know this, they don't like doing the nose.
Nose is tough.
You like the nose?
I love the nose.
Why is it they don't like doing the nose?
It's hard surgery. There's a couple aspects. You can't see very well, for one.
Okay.
You only have a certain time frame to do it until you start getting swelling, and you can't know what your final result is. And over time, it changes.
Okay.
And so there's a lot of surgically it's challenging. You have to have a lot of experience in doing it to feel comfortable that you're going to get an excellent result.
Now we're going to take a look at your before and after photos.
Great.
And I think people are going to be blown away by these. I'm trying not to endorse you, but these are probably the best I've seen. And I interview plastic surgeons nationwide.
Well, that's very nice.
What's changed, though, in the last 15 years in the world of facial rejuvenation that gives you a better result?
Well, really a lot. We stand today on the shoulders of giants in our field that have really forwarded our understanding of the anatomy and what makes a natural appearing facelift. And things that have been neglected in the past, like the mid-face, we now know a very important rejuvenation. You can fill it, to give volume that tends to be lost and redistributed over time.
Now we're talking about facelifting today, but you do fillers.
Oh, I
you
do.
do all that stuff.
When I do all those techniques that can benefit your appearance and rejuvenate things that have changed over time. And sometimes that is filler, sometimes it's fat injection, sometimes it's laser resurfacing the skin.
Okay.
All very important. This facelifting itself technically has changed a bit. We do things now on a composite level where we're moving not just the skin, tightening, pulling the skin, we're actually shifting the structures that have sunken and sagged over time. Now I do almost all my brow lifting endoscopically, which is a really elegant technique that we do with tiny telescopes on TV, and it enables you quicker healing time, quicker recovery, and gives just a beautiful natural result.
Okay, what about some of the facelifts I see, and they go by a bunch of different names?
Right.
Are some of these gimmicky, or are they all gimmicky? I mean, 72-hour lift, partial lift, weekend lift.
These are
S-lift.
These are techniques that have been around essentially since the 1920s.
Okay.
That you're just basically doing a minimal tug, little skin excision, and you're doing a minimally invasive technique. Well, that's great for some people, but the reality is that a lot of people need the skin tightened.
Okay.
Not excessively, but enough. And if you just do a little, you don't get as much of the result, and it tends not to be as long-lasting if it's simply the skin. You've got to redistribute the underlying tissues and tighten those as well.
What kind of people are coming in now for facelifts? Is it still more women than men?
It's always, I think, continue to be more women than men because, basically, women, I think, in general, are more self-conscious in our society. And I think that's always the way it's been throughout the millennium, and that's going to continue the way it's going to be. But what's changed with facelifting, the patient population, is you have two kind of separate populations now. You have the younger population who are doing things that...
Like 40s?
Yeah, 40s that come and want to look younger. And we've actually found scientifically that if you do surgery on the younger patient, their immune system response is more vigorous, and the results tend to be much more long-lasting.
Is earlier treatment better
for
when it comes to the face?
I think so. Because what happens is as you wait, two things that happen. One, as I mentioned, the immune response is less, and healing, I think, is less vigorous as you get older.
Okay.
The younger patient also has more elasticity in the skin and tends to redrape in a more natural way. But you're asking about what's the other population of patients? Well, I do have a lot of patients that are really in the kind of the second and third acts of their life, and they didn't think they would be so healthy and vigorous.
Yeah, 60 is young today.
Yeah.
There's no doubt about
60 is the new 50. I mean, people are out there that want to continue to look great, and improve themselves. And they feel great. So they say, well, you know what, I didn't think about this in the past, but now here I am at 60, maybe I want to do something.
You say it's not just for the rich and famous anymore.
Right. This is something that has really been taken on by the popular culture. I mean, it really is now much more socially acceptable than it ever was. You see a lot of high-profile people that we see all the time that have had work and will fess up to it. So I think it's no longer taboo in that sense.
Now, I told you, I said I could spot, and we talked on the phone, I could spot a facelift 20 yards away. I could spot a good facelift 20 yards away.
Right. This is the problem, Randy. I realized
you say,
when I started doing this kind of surgery, what I realized is that all my good work was invisible in a sense, I would do a surgery and the patient would look great, and there'd be some, their friends would come up to me and say, you know what, you look something changed about you. You look fresh, you look rested, you've been on vacation, and nobody could put their finger on it. And that's what a good facelift should be. You don't really understand how all little components go together, but when you put it all together, it creates a great natural result.
You say it changes people's lives.
It does. And I have a story here. I'll tell you. Patients to me are stories in a lot of ways.
Okay.
This is a patient who was referred to me because she had a surgery for her voice. She had this neurological problem that created this halting voice that really had interrupted her social life. And a very talented surgeon fixed that voice problem, sent her to me, and she basically had a complaint of a scar on her neck. And I looked at that, I started talking to her, I said, well, we can fix that. That's not a big deal. And she goes, well, while you're at it, could you kind of just lift up the rest? And we started talking about the various issues with her. Neck looseness, the skin like her mom had, the jowling here along the jawline. Okay. The heaviness in the brow and the eyes and the eyelids. These were all concerns that she had. when I realized, what she had been through with this new lease on life, that suddenly that she was now had a boyfriend, that now she wanted to write the next chapter of her life.
Okay.
She got very excited about that prospect.
So what were her options? When you look at her as a surgeon, what do you see and what do you see that could be done?
Well, from the top down, first of all, I recommend always focusing on the eyes. And for her, one of the big problems was just heaviness in the brow. Brow position had fallen with gravity. We all have these very strong depressor muscles laterally that pull the brow down over time. And so if it's just simply, bring up the brow by 1-2 millimeters is all you need to do. In addition, we cleaned up the line of the upper eyelid. We addressed some of the bagging in the lower eyelid as well, some laser around the eyelid's skin to help retexturize it. And then going down, we're dealing with issues of the jawline, neck. So what we did for her was we did endoscopic brow lift, upper and lower blepharoplasty or eyelid surgery, neck and facelift. And for some people that sounds like a lot.
Yeah, full facelift sounds like a lot.
It sounds like a lot. So she just looks like a younger version of herself. If you look at the neckline, the cleaned up jawline, the jowl area, just reverses time, just really.
You gave her about 10 years.
Yeah, and that's what she wanted.
So what does a woman like this say to you after it's done?
Well, she had, like everyone, apprehensions, her family had apprehensions, but she tells me now, having been a couple years out from this, that she's got such positive feedback from everyone and that she talks to about it. She looks like just a better, refreshed you or herself.
Now you say some of your patients become more social.
Well, the interesting story, so she ended up going through this whole process of rejuvenation with her boyfriend, who was very supportive of it. It's a really nice story. And they ended up getting married the next year.
Okay, good.
And she, again, her life was very cloistered, and suddenly now she's out, social, married again. So it's really a wonderful story. Let me show you a younger patient, okay? This is a patient who had lifelong issues with a prominent nose, fullness underneath the chin. And if you look at the picture, it looks like her whole midface is kind of heavy and she lacks good chin projection. Well, what we did for her is simply did a little bit of liposuction underneath the chin and did a rhinoplasty. Now, Randy, look at the before and after side by side. I mean, this is incredible. This is amazing.
I mean, she's pretty.
She's not pretty, she's a knockout. I mean, she's just a beautiful girl. And what you see is that suddenly, instead of that prominent nose, suddenly the nose kind of vanishes. And what we see is these beautiful blue eyes. And suddenly there's a balance. When you clean up this under the neck, suddenly you're not looking at it anymore.
So a little neck lipo.
Yeah. Neck lipo.
Nasal surgery.
Nasal surgery, and
looks
suddenly.
completely different, actually.
It's actually, it's an incredible transformation. And it's oftentimes I find the most satisfying to just clean around the edges and let people, their natural beauty, shine through. And that's what happens with the best surgery, I think.
Now, this profile shot is, again, she looks younger, she looks prettier, more sophisticated.
Yeah, and this is.
What does that person say? Because that is an extreme makeover right there.
This is a home run. You talk to this patient, and she's just so ecstatic that her results exceeded her expectation, and that's for me very satisfying.
On a consult, by the way, take me through the process. Somebody goes into you, they just don't.
They come in. Yeah, they come in for we talk about what their concerns are, and then
what do they tell you normally?
I look tired, I could look better. I'd like to look fresher. I have some of the characteristics my mom or dad had that, just makes me feel old.
What are their fears? What do they say to you?
Well, nobody wants to have surgery, first of all. I mean, there's occasional patients that say, oh yeah, I don't mind surgery. But everybody's naturally fearful about surgery. I'll tell you today, I tell patients, I'm not concerned about the safety of facial plastic surgery. The anesthesia is exceptionally safe. It's not an invasive surgery in the way we typically think of surgery. And the monitoring of anesthesia is so great. The understanding is so wonderful. It's not the procedure that it was, even 20 years ago.
What about the fear of looking different or unnatural or pulled?
Everybody says, I just want to look like me. I just want to look like a better me. And I really appreciate when people say that because nobody wants to look like somebody else. Nobody wants to look like they had surgery.
Okay.
I mean, that's not the idea of the whole process. The idea is that we bring out the best characteristics of you and refine what you have.
Now, you become one of the go-to guys in LA, the Beverly Hills area, for the natural-looking facelift.
Right.
You say you attract these people that want a natural look.
Right.
How'd that happen?
Well, having sort of cut my surgical teeth at a major university next door to Beverly Hills, I kind of
UCLA.
saw the good, bad, and the ugly, and I learned a lot of what doesn't look right, and I've fixed a lot of those patients, and going through that process makes you really think about what you're doing and why things don't look normal or natural. And it's a big education.
Do people worry that you're too young? Because I know your age.
I'm older than you, Randy.
You're about 10 years younger than you look.
Yeah, well, that's good. I don't.
You.
Yeah, I can't claim any responsibility for that. Just good genes. But
okay.
Yeah, when you're a surgeon, people want you to have gray hair, and they want you to, have more lines than I have, which is, in the end, it's my victory. But
okay, the aging face, the
Yeah.
brows, and the eyes. What do you do? What's going on?
For the brow and the eyes, I think endoscopic brow lift is still the gold standard. It's a minimally invasive technique. It looks exceptionally natural. No skin incisions, they're visible. It's a great technique. The eyes are so important, and they say that they're the window of the soul. And what I really focus on is not overdoing it. Nobody wants to have the hollowed out look. Nobody wants to not be able to close their eyes.
I mean the hollow over the eyes. I see that.
Eyes, yes. And under the eyes
is
too.
That technique driven? Is that the surgeon?
It's aesthetic. It is completely aesthetic. It's possible to take out too much. Sure.
So less is more there?
Yeah. You really want to just do what looks right and what looks natural. And don't be overly aggressive about it. Lower eyelid, the same thing. You want to really create...
the bags under the eyes?
Yeah. You want to take those out and recontour, but you don't want to flatten the lower eyelid because that's not natural either.
Okay.
I don't do any skin excision in general in the lower eyelid. We use a lot of laser resurfacing to tighten the skin. Again, I use proven techniques that give you excellent result.
Fillers under the eyes?
Yeah, I like fillers. We started doing that a few years back. It looks very, very natural. For some patients that, they're 25 and they don't want to have surgery and they have just this genetic predisposition, it's a beautiful technique. You can just sort of fill it in and it looks, lasts around 6 months. It looks beautiful.
Okay, great. We're going to take a quick break. We come back, more of these before and afters, facelifts. You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're discussing how to create a natural-looking facelift with Dr. Rawnsley. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with board-certified facial plastic surgeon, Dr. Rawnsley, and we're discussing how to create a natural-looking facelift. Okay, more of these before and afters.
Oh, this is a great story, Randy. What I want to show you is a very typical patient of mine who has a lot of the same concerns that a lot of my patients have. They basically don't feel pretty anymore. They don't feel... they feel like their look is just tired. It doesn't reflect how they feel inside. This is a woman who has some very typical changes that we see.
Okay.
Start down, in the neck. Always bothered her that she's developed this looseness and sagging skin. Dead giveaway of your age.
Is that a tricky area to address that neck? Because the skin is kind of bunching up.
It's a lot of like tailoring. You just have to sort of be able to orient it in the right direction and just make it look and lay it perfectly. But it's straightforward. It's not hard to do.
What were her goals? Do you remember?
Yeah, her goals were she wanted to look 20 years younger.
Is that right?
Well, I mean,
did they come in and say that, by the way?
Yeah, and well, she was starting a whole new chapter of her life. She had taken a mid-career retirement package. She was going to do things different this time. And
is that right?
Yeah, and so she was really excited about it.
Do you say, okay, I think I could do that?
Yeah,
when you see somebody, do you say as a surgeon, oh, this is perfect?
Oh, sometimes you just know that these patients have a natural beauty in them that I know I can just release, and it just looks great.
You feel that way.
I just love it.
So what did you do for her?
Well, what we did was we addressed her neck. That was straightforward. You see in this area where she has the jowls and this pre-jowl crease, we addressed that and just cleaned up the jawline. When you clean the lines of the face up, it's like getting a good haircut. It just looks.
So this is a
natural.
Facelift. Is what you were going to do for her?
Yes. Now I want you to look at her eyes, Randy. You can see the heaviness in the brow just above this part of her eye laterally here. Now, you could take out skin, but in her I was concerned that would not look normal. It would look maybe a little hollow. So what we did is an endoscopic brow lift. And we addressed the bags in the lower eyelids, did a little laser there as well. And look at these results. I mean, this is so gratifying to me.
Yeah. Oh boy, that is different. That looks like her younger sister or possibly even daughter.
Well, she's now taking acting classes and is trying a new career. I mean, she looks like a new woman. Randy, you said you could spot a facelift from a mile away.
Yeah.
If you saw
20 yards, I said.
Okay, 20 yards. If this woman was walking down the street, would you say she had a facelift?
No, I wouldn't.
Yeah.
I mean, she looks great for her age.
That's the way it should be. Randy, what else do you see about her?
I think in the after, she's sexy. I mean, that's a sexy, pretty woman. Her hair's different, by the way.
Right.
In the after.
She changed her hair, and she changed her whole feel about herself. I mean, she really looks more confident. She started exercising, and just a whole new.
But people do that, by the way. They get one thing done, or maybe they have their face, and then they start taking better
I see
care
that.
of themselves.
I see that. It's part of a trend. When I look at patients, the best patients that come to me are the ones that have the spirit of rejuvenation, rebirth. They want to change their lives, and it shows in lots of things. The way their jobs, their spiritual growth, their exercise, and I'm just there to enable their appearance to match that
What do
rejuvenation.
you think somebody should look for in a surgeon that's going to address the face with surgery, whether it's minimally invasive, facial rejuvenation, or a full facelift? What should they look for?
It's always been a referral pattern of word of mouth, which I think makes a lot of sense because you see somebody that had a good job and you go to that doctor.
So what should somebody look for in somebody that's going to do their facelift?
Well, I'm biased. I strongly feel that they should be board certified in facial plastic surgery or plastic surgery, that they have a keen interest in it. It's what they do for a living. And look at their work. I mean, that really is very important.
Do people pick a surgeon without looking at their work? You think
no,
that happens?
but it's hard to shop. It's not one of those commodities you can shop for very easily.
Okay.
And so oftentimes, the first person or second person you go to is the one you go with. You don't really have good informed consent. And that's part of the problem of choosing surgeons, I think, for patients. Anything overdone looks overdone, But if you do things judiciously with an eye towards beauty, it can be beautiful.
What's the number one reason you would say why people say, okay, I've got to get a facelift or I've got to do something about it?
They just don't like the way they look anymore. I mean, they used to like the appearance, and now they feel like it doesn't represent who they are anymore. And they're feeling great about themselves. They're feeling healthy. And usually it's some change that happens, a life event, whether it be their daughter's getting married or they've just gotten divorced and they're out on the
they're single again.
They're single again. So there's a variety of reasons, but they all have to do with this change is kind of pushing them to do something they wanted to do, and we all want to do. We all want to look better. I mean, that's the whole idea. But this is sort of a turning point for them.
Now the men that come in, what do they want?
Men, number one is
that neck? Mostly neck?
Hair restoration and neck. That's what they want, and that's beautiful for men. Because men, you just have to kind of clean up the edges, because men typically aren't as self-conscious about all the lines and the face, the fine lines around the eyes. It's just not bothersome to them. But the big heaviness and the fat in the neck, that's something that the men can identify with and they want to fix.
Do you ever touch the brows on a man? I mean, can't they give them I've been told, a feminine look?
Yeah, you have to be really careful. I just did a gentleman who, that was his number one concern. I don't want to be harassed by the guys that I know. They're going to give me a lot of grief about this if anything looks like it's been done.
Yeah.
So we were conservative, We do the neck, we gave him some hair. He's so happy.
Looks good.
Yeah.
Complete makeover for this guy.
Complete makeover.
All right, we have time for one more.
Okay. This is a woman who, just a wonderful, charming woman who was a teacher and was surrounded all the time by younger people. And one morning she looked in the mirror and she realized everybody's getting younger except for her, and she's looking older and sadder, and she no longer has that vibrancy that she once had. So you can look at this picture and what you see is kind of a sad appearance. The face looks drawn out, and that's partly because of the jowling in this area, the loss of volume in the lower face, around the mouth, hollowness in the eyelids, and the brow is heavy, and she's having to hold it up. So what we did on her, Randy, was a facelift, a neck lift, endoscopic brow lift, and upper and lower blepharoplasty. And Randy, look at this picture. I mean, this is
looks
something
nice.
It just makes you so happy
She's
looking
pretty.
at her. She's beautiful, and that natural beauty that she has always had just comes out. That's what a good face
and
looks
again,
all
does
about.
not look tight.
No.
Or pulled.
No, not at
Very
all.
nice.
All right. And you can see from another angle too that she has this neckline and jowl that was really disruptive to the eye, all of a sudden cleaned up, and just looks very natural.
Okay, great. Now listen, we're out of time completely. Final message, somebody unhappy with the way they're aging. What do you say?
This is my final note. There are so many great techniques out there that create a natural result. Find somebody that will do a great job for you and do it. It's such a positive thing in people's lives that I've seen throughout my career.
Your consults in LA, you do them?
I do them.
You always meet one-on-one?
I do. Nobody else does a surgery. Nobody else will meet with you. It's just you, me, in the privacy of our exam room. And, you can go to our office call.
Well, thanks for coming in.
Thanks
Very
so much,
good.
Randy.
Very interesting. Great
it.
photos, by the way.
I appreciate that.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.